Hi everyone, and welcome to the Better Futures Forum and this session on prioritising health and the national climate response. In this session, we're going to learn more about the connections between protecting human health and protecting the health of our shared planet. My name is Dr. Georgia Behrens, and I'll be your host today on behalf of Better Future Australia's Health Working Group. This group is made up of an incredible coalition of health organisations, including the Climate and Health Alliance, Doctors for the Environment Australia, New South Wales Nurses and Midwives Association, the Victorian branch of the Australian Nursing and Midwifery Federation, Australasian Healthcare and Hospitals Association, the Australasian College for Emergency Medicine, and the George Institute for Global Health. I'm a junior medical officer, usually based in Sydney, but currently working on Wiradjuri country in central western New South Wales. I've spent the last couple of years working on climate change and health across a number of wonderful organisations, and it's a real privilege to be facilitating this discussion with some incredible experts in climate change and health today. Before we go any further, we all want to recognise Aboriginal and Torres Strait Islander peoples, the traditional owners of the lands we live and work on. We acknowledge that sovereignty of the land we call Australia has never been ceded. We commit to listening to and learning from Aboriginal and Torres Strait Islander ways of knowing, being and doing. For those of us in healthcare, this includes understanding and better reflecting the holistic nature of Aboriginal and Torres Strait Islander people's paradigm of health, which encompasses the total well-being, not just of individuals, but of community and of country. Before I introduce our fantastic speakers for today, I want to encourage everyone who's attending to use the chat feature located in the right-hand side of your screen. We encourage everyone here today to share your own research, links, or thoughts throughout the discussion today. We will have a Q&A session at the end of the presentation. And when we come to the Q&A, you can either write your question in the Q&A tab or virtually raise your hand, and we'll bring you into the session with your video and audio when it's appropriate to do so. Questions in the chat feature. If you need to contact our events team or tech support, navigate to your inbox at the top of your screen and you can search event support for an instant chat to help out with that. I'd now like to welcome our first speaker for our session today, who's Associate Professor Ying Zhang. Associate Professor Zhang is a senior epidemiologist at the Sydney School of Public Health at the University of Sydney. She's a dedicated researcher and educator on climate change and global health with over 100 publications in this field. Ying is the co-chair of the MJA-Lancet Countdown on Health and Climate Change, which produces annual reports to track Australia's progress on health and climate change. Ying is also the convener of the Sustainability, Climate and Health Collaboration based at the University of Sydney. She is keen on promoting research translation and policy advocacy to address health and climate change, and does this through leadership roles in the Australasian Epidemiological Association and as a member of the World Health Organization's Civil Society Working Group on Health and Climate Change. She has received prestigious awards such as the Australian Prime Minister's Endeavour Fellowship. Welcome, Associate Professor Zhang.
And thank you, Georgia, for the kind introduction. Hello, everyone. I'd like to start with the acknowledgement of the traditional owner of the land and pay my respect to elders past, present, and emerging. I have been co-chairing the Australian National Countdown on Health and Climate Change project with Professor Paul Becks at Macquarie University in collaboration with the Lancet Countdown and the Medical Journal of Australia. And the team includes more than 20 experts from different disciplines in about 30 institutions in Australia. It's a great pleasure to be here to speak about our project and more importantly, highlight the gaps in current policies in Australia to address climate change and health. As you may have noticed that the IPCC 6 assessment report released last week has once again highlighted the unprecedented changes in our climate system. And it is very clear that human activities are the main contributor to these changes. Unfortunately, I don't see much positive news in the report. We will experience more extreme heat events, more floods, droughts, and other natural disasters. Climate change has already affected the underlying social and environmental determinants of our health, resulting in more infectious diseases, non-communicable diseases, mental health issues, and injuries. Timing is very crucial for us, especially when we ask ourselves what type of future we could leave for our children and grandchildren. So the aim of our Countdown project is to develop indicators and track the national progress on health and climate change to inform policy changes in Australia. And the indicators are from 5 sections, including health impacts, adaptation, mitigation, finance, and public and political engagement. We have published 3 annual reports since 2018, and will continue until 2030 in line with the time framework of the Paris Agreement. I'd like to point out some findings from our reports here. The 2020 reports indicates that Australia has experienced one of the greatest exposure to fire risks globally. The annual average days of population exposure to bushfires in Australia increased by more than 20% from 2001. Although there have been positive actions at the local and state levels, there is still no action, no national climate change adaptation plan for health in Australia. While globally, 50% of the 101 countries surveyed in the 2020 Global Countdown Report have developed a national assessment on the vulnerability. Have developed national health and climate change strategies or plans. There is also no national government assessment report on climate and health issues in Australia. And once again, globally, about half of the countries in the global report have conducted national assessment on vulnerability and adaptation for health. We have seen an increase in the share of renewable energies in Australia, but compared with other similar developed countries, Australia lags far behind in terms of the transition to renewables. When we look at the emissions from the health sector, we also see increased emissions in Australia and globally. So in addition to highlight the vulnerability to climate change, we have also identified opportunities to engage with and act on climate change issues for protecting Australians' health, especially in a green recovery from the pandemic. We recommend building community resilience to climate disasters and accelerating the transfer to renewable energy and public transport in order to achieve health co-benefits from climate change mitigations. We call for a national strategy to address climate health and well-being. So in order to increase the policy impact of the Countdown report, we also develop policy briefs each year. And thanks to Georgia, she has been the lead author on this policy briefs over the years. We develop the policy recommendations based on our findings, as well as consultations with a range of stakeholders in Australia, such as Climate and Health Alliance, RSAP, Australian Medical Association, and new partners are joining this year, including Public Health Australia Association, Australia Indigenous Doctors Association, and Australian College of Nursing. So over the last couple of days in the forum, I listened to the sessions focused on health systems and health workforce, and I'm very excited to hear stronger and passionate voices from the health sector on climate actions and policies. I'm pleased to let you know that this year's National Countdown Report and Policy Brief will be released in late October before the COP26 to give another push to the government for changes. The report was just accepted by MJA last week. Please watch this space. I can't mention it enough that collective efforts from multiple sectors are required to protect people's health from climate change and to achieve the shared vision for a better and healthier future for Australia. So in the particular lack of leadership in the Australian federal government, please help us distribute the countdown reports to your network if you could, and feel free to get in touch if you need more information. And thank you very much.
Thank you so much, Ying, for providing that assessment of how Australia is going on acting on climate change and health, and sort of some of the opportunities that we might have to push the government to do a bit more on this over the next few years. We'll now hear from Dr. Diarmid Campbell-Lendrum. Diarmid Campbell-Lendrum is the head of climate change and health at the World Health Organization headquarters. He has worked on this issue for over 20 years, playing key roles in the first quantitative estimates of the global health impacts of climate change, resolutions of the World Health Assembly, WHO global conferences, and the expansion of the WHO's climate change and health support to over 30 lower, middle and income countries. Diarmid is the author of over 100 journal papers, reports and book chapters, a lead author on 3 intergovernmental panel on climate change reports, and of the first health report to the UN climate negotiations. Welcome, Dr. Campbell-Lendrum.
Event. And just to follow on from what Professor Zhang has just outlined, at the World Health Organization, we consider climate change to be probably the largest health threat that we face for the coming century. That's something that's our previous Director General has said about 15 years ago now. It's also been the front cover of the Lancet shortly after that. And even in times of COVID, when the whole world, including Australia, is struggling to deal with the COVID emergency, we have been clear that it's important not to take our eyes off the ball on climate change. In May of last year, even in the early stages of the COVID pandemic, WHO already published a manifesto for a healthy recovery from COVID. Recognizing that the decisions that governments make in responding to the COVID crisis, and we already had our eye on the Glasgow COP at the time. If we get those wrong, then we end up down a path which is potentially disastrous for the climate and therefore automatically disastrous for public health. That manifesto has basically 6 prescriptions. The first is to preserve nature. Basically, there's no life on a dead planet. The second is ensuring basic health services, including ensuring that they're climate resilient. The third is driving the transition to a clean energy future, so getting off coal with effective immediately, with the rest of the fossil fuels to follow on as soon as feasible after that. Ensuring that our food systems are sustainable and healthy. Ensuring that our cities make the transition to urban designs that allow people to walk and cycle and provide basically a low carbon health and healthy lifestyle. And the last of these 6 prescriptions is to stop subsidizing pollution. At the moment, if you take into account the health damages that come from the energy sources that we're currently using around the world, in addition to direct financial support, the world effectively subsidizes polluting energy sources by over $5 trillion a year, according to the IMF, which is more than all governments around the world spend on health. This is a ridiculous and ultimately destructive path. So we're clear that as we look at climate action and COVID recovery, then we have to also make sure that we're taking actions that are good for climate protection at the same time. And as we now start to, well, continue to look towards the climate change COP at the end of the year, you will be aware, of course, that this is the most important climate conference since the Paris conference in 2015. We're also very confident in making the case that health is actually the strongest argument, the strongest positive argument for climate action. And the reasons that we have for that are first, the absolute necessity to drive down emissions and control climate change. As Professor Zhang has just outlined, the latest IPCC report has actually, I would say, not said very much new in terms of what we know about the impact of humans on the climate. We've known that for decades now, but it does point out that in fact the impacts are harder than we would expect at this level of warming. I'm based in Europe. We're just smashing temperature records now for Europe, and I understand that last month was the hottest month on record globally around the world. So we absolutely have to drive down emissions including in order to protect health. But we also know that the health benefits that would come from meeting the Paris Agreement, if you put a valuation on those, would more than pay for the costs of mitigating climate change globally. And that's just through improved air quality. So that's also part of the reason why health is such a strong argument for climate action. And then within the COP itself, as you've just heard, one of the health community's big pushes is to try to ensure that the national climate commitments, the nationally determined contributions from around the world, do include health. They do include actions to protect people's health from the climate change to which we are already committed. But much more importantly than that, we think it's important that these commitments also take into account the big health benefits that would come from climate action, these health co-benefits that I've just been mentioning. And I would point you to an important resource, including the fantastic Lancet Climate Countdown reports, the global report, but also the Australian and others. So our colleagues at the Global Climate and Health Alliance have also been reviewing the NDCs and the other commitments that the countries are making, and basically grading how well they do in including health within them. And it's a very mixed report card. In fact, most of the nationally determined contributions now recognize health, but very few of them so far recognize the great health co-benefits that would come from climate action. And then just a couple of words on our program within the COP itself. For the first time, there is a formal recognition, or a formal health program within the COP. So there's a series of high-level events. WHO is also producing a report in consultation with the global health community on the health argument for climate action. And so we're already carrying out public consultations on that. And we would encourage you to pick up on that and input into it, again, because we consider health to be the strongest argument for climate action. We also have, in partnership with the UK presidency of the COP, two specific initiatives whereby we're encouraging countries to sign up to commit to ensuring climate resilience of their health systems as one commitment, and the other is on greening their health systems. You're probably aware that healthcare around the world is now responsible for 4 to 5% of global carbon emissions. And we're starting to see real movement, in this case led by the National Health Service in England, to get to net zero, a net zero health system within the UK by the 2040s. So those are the specific things that the UK presidency is asking countries to sign up to. But the final thing I'd like to say, the most important part of all of this, is that we're also continuing to work with healthcare workers and health professional associations around the world to have this drumbeat of support from the health community for stronger climate action. If you ask people in the street what they're concerned about climate change, and if health is one of the options, it tends to come out top. that it is something that people are critically concerned about. And the final strength that we have is that the health workers, the health community, are not only one of the most numerous professions in the world, they are the most trusted profession in the world. In contrast to journalists and politicians who are at the other end of the spectrum, there is nobody on the planet that is more trusted than a doctor, apart from a nurse. And so we're absolutely committed and have a really strong relationship with healthcare professional associations and through the WHO Civil Society Working Group and the Global Climate and Health Alliance and others. And we'll really look forward to working with this community in partnership with those who are working on climate action to use health as its rightful in its rightful place as one of the strongest arguments for climate action. So thanks for the time, and I'll look forward to the discussion. Thank you.
Thanks so much, Dr. Campbell-Lendrum. It's really interesting and exciting to hear what a key role the health community is playing in pushing the international climate negotiations moving forward. And I think we all look forward to seeing the outcomes of COP this year with lots of interest. We'll now hear from Dr. Tarun Weeramanthri. He is the president of the Public Health Association of Australia and an adjunct professor in the School of Population and Global Health at the University of Western Australia. He is a trained specialist in internal medicine and public health and has a PhD in social medicine. He was Chief Health Officer in Western Australia from 2008 to 2018 and in the Northern Territory from 2004 to 2007. In 2014, he was awarded the Sydney Sachs Medal by the Public Health Association of Australia for his contribution to public health in Australia. From 2019 to 2020, he conducted a statutory inquiry into the impacts of climate change on health in Western Australia. And since 2020, he has worked with governments across Australia, state and federal, on the COVID-19 response, including the National Contact Tracing Review and review of hotel quarantine arrangements in WA. His interests are in how public health and good governance can contribute to change processes to address climate health, COVID-19, and future global health threats that threaten equity and solidarity. Welcome, Dr. Weeramanthri.
Thanks, Georgia. I'm speaking to you today from the lands of the Whadjuk Noongar people in Perth. I'd like to acknowledge the traditional owners and pay my respects to their elders, past and present, and thank them for their stewardship of this country over 3,000 generations. We've heard about the science and data of climate change, its global significance, and its environmental impacts. Health researchers have carefully described its precise physical and mental health impacts. They're building us a library of knowledge of the links between climate change and ill health, whether it is the effect of extreme heat on children and the elderly, or the impact of air pollution and bushfires on respiratory disease, or the anxiety that comes with years of drought. So what do we do with this library that can lead to solutions and change? Of course, yes, make it accessible to everyone and free. But more importantly, recognize its significance as not just a compilation of data, but as a companion to a collection of stories. To trigger action, we don't only need creators of knowledge, but also curators and tellers of stories. And in my experience, this is often the missing bit and where health comes in. Numbers are impressive, but impersonal. In someone's famous phrase, statistics are people with the tears wiped off. Combining statistics with stories is way more powerful as a trigger for attention and action than either alone. And this combination is also the essential element of health and medicine. An encounter with a patient starts with the taking of a history, an individual story, moves on to a physical examination, a combination of sight and touch of our senses, and ends by gathering of data from special tests. If the planet were a patient, we would recognize her as sick when she walked into the emergency department. The diagnosis would be obvious, namely serious overheating, and the cause easily identifiable from the history, namely man-made burning of fossil fuels. We would recognize the impacts, both environmental and health, written into the planetary body and experienced through our senses. The testing data would be overwhelming in its consistency, and the medical records would be a series of thick files labelled IPCC reports 1 to 6. If the planet were a patient, we would see immediately that she was deteriorating and an urgent response was needed. We would recognise that doing nothing was not an option and ethically unsupportable, as would lead to continuing harm. That merely treating the symptoms and not the cause would lead to further deterioration, and that further treatment delay would be fatal. And that, on the other hand, treating the patient, the planet, with existing known remedies will lead to extraordinary co-benefits, reducing, for example, common chronic diseases and air pollution, and benefiting everyone. So, health professionals being pragmatic people, the decision to act on climate is not hard to make. We in the health sector accept that we are responsible, public and private both, for approximately 7% of all emissions in Australia. Many professional colleges have called out the climate emergency for what it is. They have hit the code red button. Perhaps us older professionals have been moved to action by the whisperings of young people, our students, around the bedside, asking, why have our teachers and leaders not acted on the science and evidence of climate change as they have taught us to do for other serious health threats? There are now calls from the top of the health sector to lead by example. So, in the lead up to COP26 and in the years after, what might this leadership and action look like? Firstly, the sector is taking responsibility for its own emissions and substantial waste, including single-use items and plastics. All state and territory governments have committed to net zero by 2050, so we have to reduce emissions and waste at least as fast as other sectors. Our size gives us some advantages. We are big buyers of goods and services, so we have purchasing power that can reshape supply chains and procurement practices. We employ many thousands of workers, so small changes in how we get to work or how we recycle materials adds up quickly. And some of the greatest opportunities lie in changing the way we deliver care from hospital to more community-based and with a greater emphasis on prevention. As we pledge to do more as a sector, we also urge the Australian government to be more ambitious for our country. A national climate and health strategy is put forward by the Climate and Health Alliance is overdue and essential and could form part of Australia's nationally determined contributions, which currently omit health altogether. We must reduce the striking gaps between national commitments, Paris Agreement targets, and actual emission reductions, between actions individuals take to reduce waste at home and what they can do in a healthcare setting, and between the care the health system provides to the individual in front of us and the responsibility we have for the next generation. The most fundamental gap to fill is the relative lack of healthcare access for groups in society who have the greatest vulnerability, have contributed the least to emissions, and are impacted the hardest. Climate action without fairness or justice is not ethical from a health or public health perspective. We in the health sector are also aware of our own power and influence in society. We know we are trusted by the public, but should not take that for granted or lightly. As part of the status quo, we must be part of the problem too, and we will need to heal and change ourselves as well as others. Our privilege can be turned into influence for good. Taking finance as an example, individual health professionals are looking at their personal choice of superannuation fund, while health professional bodies will be asked by their members who they bank with and why. As advocates, we can also speak to our patients, the media, and the public about climate and health, lobby politicians, speak up and activate our networks, and use our positional influence to get the issue on the agenda at all kinds of meetings. Lastly, we can and do commit to not just advocating, but allying or partnering with others. During our year-long Climate Health WA inquiry, the link to which is in the chat box, all agreed that climate action is everyone's responsibility and committed to supporting government action and leadership. In the inquiry, we collected and curated a collection of stories from WA, not just of the diverse environmental and health challenges in different regions, but of the positive responses from local communities and new partnerships between civil society organisations and healthcare providers. We recommended that WA Health establish a sustainable development unit to catalyse and coordinate this growing activity into measurable change. Our model, the SDU in the UK, helped the National Health Service cut emissions by 18% in a decade, while activity rose by 27%, saving approximately £90 million annually. In summary, health professionals as a group firstly care and then do their best to cure. If the planet were a patient, we would tell and respond to her story and answer yes to 3 questions. Is the patient sick? Do we know what to do? And can we do more and quickly? Thanks, Georgia.
Much, Dr. Weeramanthri, and wonderful to hear about the work that's been done over in Western Australia to try and make the healthcare system more sustainable over there. Just for the audience, we now have the opportunity for you to ask your questions to the speakers. To do that, you can either direct your questions to a particular person on the panel or the panel as a whole. Please, if you haven't done so already, write your questions in the Q&A section, not the chat, on the right-hand side of your screen. Or you can virtually raise your hand and we'll bring you into the session with a video and audio to ask your question live. Just to get us started, I had a couple of questions for the panelists before we go to the audience questions. My first question was for the panel. Dr. thought it was really interesting for you to say that the challenge for the global health sector is not to take our eye off the ball when it comes to climate change, given the current COVID response. I'd be interested to hear the panel's response on how we're doing that, both internationally and within Australia, in terms of keeping some kind of focus on climate change in the healthcare sector. I might go to Dr. Campbell-Lendrum first.
Yeah, well, thanks for that. I think that globally, I would say that the world is to some extent taking its eye off the ball in terms of climate change in response to the in response to the COVID crisis. Again, pretty early on, we and others started to look with interest on where COVID recovery funds or where the economic packages that were going into prop up economies, particularly those economies which were going into quarantine early, in Europe and elsewhere. Obviously, money needed to go in to protect people, to protect their jobs, to protect their livelihoods. And the money was also effectively going in to protect certain industries. And it seems pretty clear now that as you look across the major economies, a lot of that investment, there was a certain amount of talk that investment needed to be green investment. And yet still we see that a large part of that investment, much more of that investment, went into propping up those industries which are basically over the long term killing the planet. So a lot more of that, those recovery funds went into fossil fuel support for the fossil fuel industry than went into making the transition to the green energy future that we all need and is now economically sensible and is now good for the planet. So we need to keep documenting that, and we need to keep putting out the data, and we need to keep making the argument as to why that has to change. Some of that reaction, of course, was an immediate reaction. It had to happen fast, but a lot of this goes on over a longer period of time, and so we have to keep that pressure on. And there is a direct link between what countries do in response to COVID and what they're now promising to do for Glasgow. These nationally determined contributions are critically important. They are the promises that countries are making effectively to future generations. They're saying how ambitious countries are prepared to be on climate change, and it's important that they're both ambitious and that they're serious. It's one thing to make a big promise for 2030 or 2050, but we also need short-term targets to make and documentation of those and follow up on those to make sure that those are implemented. And I would say that in any of these, health should be central. People want it to be central. Again, if you ask people in the street what they're concerned about, health always comes out very high on the list. And as I said, we also know from the evidence that it's now the rational thing to do. It's the economically rational thing to do, to take into account health in making these decisions, because the health gains are so great, whether we look across air quality or more sustainable transport or more sustainable food systems. So yeah, it is a case of keeping our eye on the ball, but also I would say making the positive argument that we also know that a positive vision of the future is the thing that will actually bring people together, even across political divides. So that's why we think it's important not to take our eye off the ball.
Could I ask if either of our Australian panellists would like to comment on how Australia is going with integrating climate change response simultaneously with our COVID response?
Thanks, Georgia. So just responding to what Diarmid said just then, I mean, I think we just have to, stop doing silly stuff. That was President Obama's foreign policy, and I've always thought it's a good way of thinking about it. So silly stuff is that incredible statistic that he shared about $5 trillion worth of subsidies greater than the health sector. That's a current silly stuff thing. So stop subsidising would be a good start, and then not making future commitments around new coal or other fossil fuel developments, and Australia's currently right in that space. Even last year, we had the talk about a gas-led recovery from Australia in terms of COVID. We've had less talk about that this year, so maybe there's been some strong pushback from the community that that's not the way to go. But we, having stopped that gas-led recovery concept, we still haven't got a positive concept of what we should do in terms of the COVID recovery. And I think, though, that this next couple of months might help us get there if we can use the international negotiations to create pressure for a nationally coherent response, especially prior to our election next year. So a couple of quick other things. One is the multi-level stuff. So we need to link up this conversation internationally, nationally, and then also state-based and regionally and locally. And there's different speakers here who are doing this at different levels. So my colleagues are international, national level. I've been working at a state level. But the most important response is always local and community, and we need to link all of that up. And then a couple of other points is around the power of health to tell particular stories. And I think the stories around heat and around air pollution are particularly easy to kind of communicate with the public and make that link between climate change and health. And so there's some great heat researchers, some great air pollution and bushfire researchers. We're living through these incredible extreme weather events, and we need researchers and policy people and health people talking about how these things are related with the Australian public. Thanks, Georgie. Mm-hmm.
Others said, and as always, we are not dealing only one disasters at one time. We are always dealing with multiple disasters, and I am actually using the COVID responses in my teaching on climate and health, because there are certainly lessons learned from the responses to COVID. For example, we need why the policymakers should listen to the experts, listen to the health professionals, and how we can better communicate the health risks in the context of climate change is more complicated, and to increase the risk awareness and the willingness to respond and to act. And also, I think we need more like resilient health system, either be a pandemic or a natural disaster. We need to be more prepared, because we know that there are more disasters are coming. So I think we can, any recovery plan from COVID without thinking of the more long-term health risk from climate change is short-sighted.
Thank you, everyone. I'll go to some audience questions now. The first question that we have today is from Emily Sinnott, which is a question about how Australia's got some quite effective public health campaigns in schools and community organisations around health threats such as smoking and alcohol, and whether anyone on this panel would be interested in commenting on whether we should be looking at integrating climate and health education in schools and other sort of sectors.
Yeah,
I'll just say quickly, I think it's a great idea. I think it's, in our inquiry, we didn't look at that enough. I mean, we talk about building awareness. That's a kind of general community level awareness, but it also has to be really more specific. And we need our, education colleagues to help us do this. It's not something that health people particularly know about. And so I think this is where the partnerships come in, that we have to educate and build awareness at all levels, but also about the capacity to act, not just about the capacity to inform about the problems. Thanks.
If I could come in, I also think that that's a really good idea, and it's something that we also see the demand for coming from younger people, including younger medical professionals as well. One of our earliest and strongest collaborations on advocacy in this area was with the International Federation of Medical Students Associations, and they review the extent to which their training courses around the world take into account climate change and effectively grade them. They grade their professors, or they grade their courses, and fail a lot of them because they're not including climate change within the curriculum. And we also know, within Australia, but we see around the world, the engagement of younger people, people from school age on climate change, and most of them also generally get the connection with health. So as Tarun has just said, it's about making sort of giving them the simple evidence-based messages to back that up with the simple solutions that also push that in the right direction. And there are many around diet, around physical activity, around air quality and asthma and so on. But yeah, that seems to be very much the way forward.
To that, I'm a member of the WHO Global Climate and Health Alliance Working Group Health, and we established a subcommittee focusing on capacity building and educational programs on climate and health. So we are really keen to push the integration of climate and health contents into curriculum, not only for medical schools, but also for all health professionals and younger generations, because after all, it's intergenerational issue. It's their future. Yeah.
Fantastic. Another question from our audience member, Barbara, which is, I'll just summarise, effectively wanting to know about what the evidence is around the impact of climate change on mental health at this point, and whether there's any sort of emerging research in this space. I don't know whether, Ying, you might be able to speak to that and what's been found in the Lancet Countdown.
Yeah, in our first report in 2018, we developed an indicator on temperature and incident suicide rate in Australian cities, and we found positive associations between increasing temperature and the suicide rate. And there are lots of scientific evidence on mental health impacts from extreme weather events such as prolonged drought in Australia and bushfires and floods. I'm not sure whether there is any cohort longitudinal studies looking at specific mental health outcomes related to changing climate, but I'm sure that there are data on this topic, especially from Australia.
Wonderful. Just to, I suppose, summarise another question as well, a question from Emily again, about how the healthcare sector can better, I suppose, push or support the federal government in the lead up to COP. I suppose it's interesting the contrast between governments really following to the letter, it seems, health advice in terms of COVID, but really not responding to a quite consistent, unanimous health message about the need to act on climate change. Can the health sector be doing something differently, and how should we be supporting the government to take more action?
Try to respond to that. Certainly our approach in WA has been to say to government, look, we're there with you. This is not one of those issues where we expect you to act and we'll sit back with our arms folded and judge you. It's, if you act, we'll be there right beside you, supporting you, because it can't just be your job, it must be all of our jobs. So that's the first thing, and turn it into a positive for them. that, the health aspects are, the co-benefits argument, they're all very, very positive. The economic savings argument, these are all wins for government. And, it's about partnership, it's about being positive, it's about seeing health as an asset, as well as being also using our kind of professional expertise, networks and influence, put an arm behind someone's back and push it up a bit. It's just levering people slightly, because we're quite powerful professionally, and we're trusted and we're important politically in all sorts of ways. So if we can put a positive message, and we're all together, and all of these different areas of health which normally argue get together and say we're unified, it has to have an impact on government at some point.
If I could just add quickly to that, I agree with all of that, and again, the evidence is that a positive framing around health is more convincing to people. We now have sort of trial studies of that, and I think that's exactly right. Politicians in general, and particularly around climate change, are used to people shouting at them and telling them they're doing it wrong and not doing enough, and that may be true, and it is true. But that sort of supportive case that we will get behind stronger action, and we have additional voices, we have additional arguments for why we should move on this, I think is ultimately going to be much more powerful along with that push. But I would also say that it also matters what goes on within the health sector. As I mentioned, health is now a significant emitter of carbon emissions. It's also 10% of the global economy. So it's a big player now in terms of climate policy. And we also see that if you have leadership on this, then that has a wider political impact as well. And I would just point again to this example from the UK, where the National Health Service in the UK is effectively our national religion. And the fact that there has been a commitment that the NHS will be carbon neutral by its 100th birthday in the 2040s, and there is now actual significant financial investment in that. That is not only meaningful in terms of reductions of carbon emissions from that country, but it also has a wider political impact as well, because you've effectively got that big trusted body of doctors and nurses basically going on along with this, and that sends a wider signal to society and politics as well.
I also like to say that there are frustrations for sure, but also it's a big motivation for us to continue our efforts to push this forward.
Wonderful. I think that's a really nice note for us to finish our discussion on today. Thank you everyone so much for your insights into what is happening in terms of climate change and health in Australia and worldwide, and how people in the audience who are interested in using the health message to push a more positive climate action in the future could do so in the next little while. I look forward to joining all of you in the ongoing efforts to build a more healthy and resilient future for all of us. Thank you everyone for joining us today. In a moment, everyone here will be automatically moved to the next session to wrap up before we head to a break. Thank you all so much for joining us here today, and we will see you soon.
Thank you.
Thanks, everyone.